This is the Wilmington Standard Daily Update for Monday, December 1st, 2025. According to a report released by the U.S. Department of Health and Human Services last week, the gender-affirming model of care, as practiced in U.S. clinics, is characterized by a child-led process in which comprehensive mental health assessments are often minimized or omitted, and the patient's embodiment goals serves as the primary guide for treatment decisions. In some of the nation's leading pediatric gender clinics, assessments are conducted in a single session lasting 2 hours. 2 hours is all it takes to send children and their families down a dangerous road of puberty blockers, cross-sex hormones, and surgeries, all based on a child's self-reported sexual identity. If a child wants to get a tattoo, he has to wait. If a child wants to smoke, she has to wait. But if a child is not feeling at home in his or her body, a passing and normal condition that will resolve itself on its own in most cases, a consultation of 2 hours can result in infertility and sterility, sexual dysfunction, impaired bone density accrual, adverse cognitive impacts, cardiovascular disease and metabolic disorders, psychiatric disorders, surgical complications, and regret. All side effects beyond the understanding of most adults, and certainly beyond children. But let's let them make the decisions guided by ideological professionals in gender clinics. Thankfully, North Carolina this year passed House Bill 805, which defines only two sexes, male and female. It also extends the statute of limitations to 10 years for those who want to file medical malpractice suits and civil complaints against those who provided the care. All Republicans voted for the bill. Not one Democrat supported it. Not one stood up to protect children. Every child psychologist and school counselor who convinced parents that their child would be better off, every surgeon who used a knife on a child to cut off body parts, every clinic who prescribed chemicals that burned away at a child's innards is now able to be sued by those they harmed. And they should be. Sued for every penny they have, and sued out of business in North Carolina, and sued so no insurance company will ever allow them to operate and mutilate children again. Perhaps we can start to end this madness. For the Wilmington Standard, I'm Rule Sample. Thanks for listening.